Okay, so I'm going to start my 6th treatment of laser therapy using the Powertwin 21 Plus infrared laser system on my leg for nerve-related pain. So how have I got this nerve-related pain? Well, it started 10 weeks ago when I got COVID pretty severely. I was ill for 2 weeks, and this was followed soon after by diagnosis of a deep vein thrombosis in this area, which was thought to have started probably in a superficial clot in this area, in a superficial vein. This was followed by an extremely painful bout of bacterial thrombophlebitis, which is inflammation of the vein where the clot is on, so in the main veins. And I was treated with antibiotics, and it reduced a lot of the pain, but it still left me in a lot of pain that wasn't going. I had scans on my leg looking at my veins to see if I still had phlebitis, and I had no sign of active inflammation in the veins and no sign of any damage, lasting damage from having the clot in my leg, which is one good thing. But then I was left wondering, well, what is causing this pain? And the doctor said this pain is so out of proportion to what you've experienced, it doesn't add up. So by process of elimination, it's deemed that I'm now dealing with nerve-related pain. And given that I had the perfect ingredients for that, I'm not really surprised. So I had a clot blocking my circulation in the veins, stopping the circulation of blood and oxygen. I was anemic because I got very anemic from COVID. And I had a bacterial infection in that same vein. And those 3 things can contribute, unfortunately, to nerve damage. As well as having symptoms of nerve damage, I'm also showing many symptoms of a condition called complex regional pain syndrome, which arises from an original injury or a clot, such as a DVT. And the pain far outweighs the pain that the original injury should cause. And it's caused by flooding of the central nervous system of painful stimuli and traumatic stimuli, which can be mentally traumatic as well. And the central nervous system locks this whole pathway that goes from the affected limb to the brain in a state of hypervigilance. So it's like a pain memory on overdrive. So the way to treat it is to unravel that overdrive of the central nervous system and treat the nerve damage. So what are the symptoms of this CRPS? Well, I'm ticking the boxes for all of them at the moment. So my pain is very reactive to temperature. So when I have a warm bath, it absolutely kills. I won't be doing that again. Also, if I put the cold pack is too cold, that triggers the pain and it flares up again. So the pain flare-ups, there's all sorts of pains going on, but the flare-ups consist of like a burning pain going up your leg, mainly at the back of my leg, the back of my thigh, aching, just a horrible grinding ache. Can have like electric shock pains, like a stabbing that's going right through the lower leg here, which is incredibly painful, particularly when I walk. It's also very sensitive to touch, extremely sensitive. So what should feel like a normal touch or tickle is like a pain to me. So if I do this, the back of my leg feels very bruised and tender, but there is no bruise. There's nothing wrong with the back of my leg, but my brain is telling me that there is. So this is making it hard to sit down. At the moment, I can't drive. I can't walk too far because when I walk too far, my brain soon lets me know, puts me in a lot of pain again. And then there's this tenderness here, that feels like a large animal has taken a bite out of the back of my leg. Unbelievably tender. I can't put any pressure on this area here. And there are some areas along the skin that feels like trigger points, like nerve trigger points, where I can't touch them. It's just too painful. So how am I going to get rid of this? Well, I haven't received an official diagnosis of CRPS. I'm due to see a pain specialist, but won't be waiting weeks in order to receive a diagnosis. I'm going to treat it straight away, because the best way to get rid of CRPS is the sooner the better. If you leave it too long, you can be left with it for the rest of your life, and not only that, it gets worse. So one way to treat it is by using laser therapy. So what laser therapy will do is it will increase the pain threshold of the nerves. It will mend the nerve damage so that the nerves can fire correctly and give you appropriate feedback to your brain. And also I can use certain frequencies that can literally calm down my nervous system, like alpha waves, and there's this particular psyche program as well, which I can put on the sole of my feet. So that's what I will be doing. Okay, so I'm going to start the treatment now. So I'm going to use a frequency that I've selected on here called nausea E, which is a specific frequency for nerve pain and nerve damage. And I'm going to deliver 4 joules per centimetre squared to all of the tender areas on my leg till it's done. And then I'm going to look at a program to try and calm down my nervous system. So this is the 6th treatment in 6 days. I noticed considerable improvement after the 4th day. So I noticed an improvement yesterday when I got out of bed. The pain wasn't as deep and it wasn't as extensive, and I could walk further than I had done previously. And then I did notice a further improvement this morning. So I'm really pleased with those results after treating only 4 days, given that we're talking about nerve damage here. So start putting on the back here. I've got my safety specs on because the only safety precaution is you need to wear safety specs to avoid the retina seeing any of the rays and damaging it. Right. So this is one of the painful areas at the back, just here. So I don't need to put any pressure on. I just touch the skin. You can even do it away from the skin. You don't actually have to touch the skin. And I can't feel anything as the laser is being delivered. There's no warmth. I can't feel anything at all. And the beeps, that's telling me that I've had 20 seconds of treatment. So this particular program is about 1 minute and 40 seconds. So I'll apply this same program to all the painful areas on my leg. Next one's the last one. Yeah. So that's that program finished, and I'll apply this to all the other painful areas, and then I'll catch up. One good thing about laser therapy is that as well as treating pain and physical conditions, it also can treat our emotional states and mental states. And with painful conditions, and particularly with chronic pain syndromes, there's often a large emotional component of that which needs treating. And this can be done using the Powertwin 21 Plus. There's a number of different programs. I'm going to be using one that stimulates the autonomic nervous system to calm down that fight or flight, which is a big part of many chronic pain syndromes. And particularly with what I'm experiencing, I need to unravel all the anxiety that I've been experiencing over the past few weeks because of the pain that I've been in and the severity, the seriousness of the symptoms that or the conditions that I've had over the past 10 weeks. So as well as having a deep vein thrombosis in my leg and an infection, I've also had a burst lung, leaving me with a hole in it and a clot in the same lung, and I spent 5 days in hospital with that, and that was an extremely anxious period during this illness. So no doubt that's increased this wind-up state, which hasn't helped how I experience pain in this leg. So by using this program, this autonomic nervous system program, I would hope to unravel that and aid my recovery. So this is telling me how many seconds I've got left. 16 seconds. And I'm going to use the same in the other foot as well. Takes just over a minute. Almost finished. Okay, so I'm going to use that on the other foot, and then in about a week or so I'll report back and let you know how I'm getting on.